Hey guys, Peter from Edans's here. Endoscopy is a procedure where a tube with a small camera is inserted into the hollow organs to diagnose or treat different diseases. And colonoscopy is one such procedure. It is often performed for the diagnosis and treatment of the diseases of the large intestine. People are usually concerned as this is an unpleasant procedure and it can cause abdominal pain, distension, and other type of discomfort. So some patients even try to escape the procedure as much as possible and as long as possible. So it really makes sense to try reducing the negative sensations related to colonoscopy. And I've just come across a recent study that examined the effects of light piano music on satisfaction, anxiety, and pain in patients undergoing endoscopy, specifically colonoscopy. And I'd like to share with you why I think this is important research and how it contributes to the current understanding of this topic. Namely, the authors conducted a randomized controlled trial to investigate the effect of light piano music on satisfaction, anxiety, and pain in 216 patients undergoing colonoscopy. There were two groups, and the patients were randomly divided into the piano music group. In total, there were 112 patients, and in this group, piano music was played during colonoscopy. And there was also the control group, including 104 patients, where no music was played during the procedure. The results showed that the difficulty of colonoscopy operation and the score of anxiety after colonoscopy were significantly lower in the piano group, and the satisfaction of colonoscopy process, pain management, and overall service satisfaction were better in this group than in the control group. The researchers also asked the patients something like, would you go for colonoscopy again? I mean, of course not. And the two groups did not differ with regards to that question, but the piano group basically replied that if they had to do it again, they would choose listening to music again. So how do these results impact the real world? Well, I think it is important to find alternatives to reduce patient concerns related to different medical techniques, including endoscopy techniques, especially if sedation or anesthesia for any reason are not really possible. And one way to go would really be to play music and thereby improve the patient's experience of definitely an unpleasant procedure. And what I also think it would be interesting if the authors also assessed other types or intensities of music, and this is definitely something that should be examined in the future. And I'm also curious whether the music affected the way the doctors performed endoscopy, so I would like that they have also examined the doctor's perspective. Anyway, definitely there is still room in this area for research before the approaches such as this could be really promoted on a large scale. Okay, I've got to go now, but next time I find an interesting paper, I'll post again. Thanks for watching or listening.